My father was in the military. I was actually born in France and grew up on Air Force bases. I graduated high school from Cocoa Beach High in Florida. I did my training at Loma Linda University and came out to the valley here as my first and only job. I love the desert. I find out beauty in the desert, but I like the people of the valley, and I've enjoyed working here ever since. I decided I wanted to be a doctor in college, and taking science classes, I became interested in helping patients. I first did my internship after medical school in pediatrics. My father is a very famous radiation oncologist. He's actually the doctor that developed protons. James M. Slater. He's the one who started the proton therapy at Loma Linda University. He was my mentor, and that's why I became a radiation oncologist. Radiation oncology is sort of a combination of an oncologist and a radiologist. It's a separate residency in and of itself. So we study physics, radiation safety, we study radiobiology, and also studies all the systems and all the oncology systems. So that takes about 4 years of training, and that's how we become radiation oncologists. We do a procedure here called stereotactic radiosurgery. Now, it's not really surgery, but we call it surgery because everything in a small area is ablated like a surgical procedure. We do this because we have imaging and we're able to do the planning and give all the radiation instead of 5 weeks in 3 to 5 days. This allows us to get a high control rate. For instance, in early stage lung cancers, we have a 90% chance of control now, and in the old days, we would have only a 5%. In other areas, we don't use it to treat for cure, but we treat patients to relieve symptoms, for instance, in brain metastases. Instead of having to have surgery to remove them, we can treat these in 1 to 3 treatment and control the lesions in the brain. So stereotactic radiosurgery is not for everybody, but in certain tumors of the brain, and the lung, and the liver, it's a highly effective treatment. Radioactive seed implants began almost 100 years ago. Back then they used something called a gold seed, and the patient was opened up and the seeds were placed in the prostate. But it wasn't until we developed ultrasound and computerized planning that the modern era of seed implantation came. It basically started in Seattle. Nowadays, we're able to place the seeds where we want them. It's an outpatient procedure. It's done in a matter of a couple hours. The patient has a high chance of success, and even though there are some side effects, the side effect profile is very low. I think that we've made progress in all forms of medicine, in surgery and in radiation oncology. We're doing things that we could never do. But I think the next step is combining these treatments with immunotherapy. I think we'll be able to cure more patients and take care of the metastases that we can't now. A few specialties in medicine, surgery, radiation, oncology, that we have the benefits of actually curing patients of diseases that if we weren't there, they would die of. So not all our patients are cured, but it's very, very satisfying to know that we're helping people fight through their battle with cancer.